Thanks for staying with us. As cases of the Omicron COVID-19 variant rise in India, the country is shifting gears in its battle against the pandemic. The new year holds a raft of new measures for the country, including booster shots, increased vaccine coverage, and a new anti-COVID-19 pill. But experts say the risks still persist, as Ishan Garg reports from New Delhi.
As India's COVID-19 vaccination drive nears its one-year anniversary, the country has now expanded its vaccine program to include those between the age of 15 to 18 years old. The country has also approved booster shots for frontline and healthcare workers, as well as those above the age of 60 with comorbidities. To ramp up vaccine production even further, 2 new vaccines have been approved for emergency use, with the Serum Institute-made Covovax and domestically made Corbevax approved. India now has 8 vaccines in its arsenal. Added to that is a new anti-COVID-19 pill, Molnupiravir. The drug, now approved for use, has been developed by the US pharma company Merck and will be mass-produced here by 13 manufacturers. India is also imposing restrictions on movement as cases of Omicron rise. Several states have now imposed night curfews and some have even banned public gatherings. But experts say India's biggest challenge in the new year will be to fully vaccinate a third of its remaining adult population. Officials say vaccine hesitancy is still a problem among the less educated sections of society, with many skipping their second dose of the vaccine. Authorities are worried that India could see nearly 1.5 million daily cases of COVID-19 by February. Preparing the country's medical infrastructure to cope with a potential surge could be another challenge for the country. Economists are also worried about the financial ramifications. India has only now begun to recover from the pandemic-induced recession, with analysts predicting a 9% growth in GDP in this fiscal year. But they also warn that a rise in infections and the resulting lockdowns could undo the progress. Millions in the country are already struggling amid high inflation and unemployment rates. Small businesses, especially in the tourism and hospitality sector, are worried that the third wave could kill their livelihoods. But officials say that by aggressive testing, tracking, and enforcing COVID-appropriate behavior, India may be able to fare better. They also hope that rising vaccination rates and the natural immunity acquired by the second wave of COVID-19 will dull the effect that Omicron can have on the country. Ishan Garg, SABC News, New Delhi.